I wonder who is out there right now with me. It's nice to be back on stage right now in this arrangement that we have. Hello, everyone. It's so nice to be back. As you remember, if you don't, my name is Mana, as you can see, but we all together called Mana Handy Tips. Yes, we're back together today, and today is September 18. Time flies. It goes by so fast. And you have things that you mean to do and you realize that no, it wasn't done. You couldn't get it done. It keeps going and you can not get it back. And so it goes with our body, you know. So it goes with our body. And we've been meeting here all the time, exchanging tips. And it's true, until now, we've been focusing on being older, getting aged. But it will come a time where we will talk about other age range too. But the fact of the matter is, since we all are bound to age, we're gonna get there sometime, even if we're not yet. But we certainly have our parents, our uncles, our aunts, our friends that are coping with aging. I'm coping with that myself, even though I am what my mom will call you just a baby, but there are things I'm experiencing already, and that's why there is a need for us to get started with this population that we all growing into one day. So here we are back today again talking about the process of aging and the consequences that come with it, some more serious than others, but all of them certainly unpleasant. So today we're here to talk about shingles. And remember, we on radio, TV, aloe vera. As you remember, this gonna be the third, fourth time actually that we are on this station radio to be running Mana Handy Tips on now, so more people can have access to this information. And I'm so thankful that this radio TV is available for that purpose. So again, as we always say, we do encourage each and everyone to share the news. Okay, that there are some tips being given that can benefit each and every one of us. We all growing, we all getting old, we all aging, and we all feeling it, aren't we? So my name is Mana Lare for those who just catching us, and we're here to talk about some more tips regarding a certain condition that comes as we age or may even come even though we're younger, you know, and this is shingles. So you might have heard the name before, or maybe it's the first time that you're hearing it. Well, let's talk about it. Why should we be interested in it? What can we say about it? Why does that matter? What can we take away for this regarding this, concerning this, so it can benefit us or others? That's why we're here to exchange tips. Okay. So today we're going to talk about shingles. So you may seem like, okay, I hear it, but I don't really know what that is. Why don't you tell me about it? And that's exactly what I'm going to do. I didn't know so much about it. I could hear the name, I can see it on the news, and I know something's called shingles. But unless I took time to investigate, to study it, to see what it is and what can be done about it naturally, I didn't have a clue what that was. Okay. So here we are today, and we're back here with the tips and specifically regarding shingles. So, what else can we say before we get to the actual definition of shingles? As we age, we notice more outward signs of passing years. We know we're getting old. such as we have wrinkles on our faces and they get deeper and deeper. We have pronounced laugh lines. We have gray hair. See, I have few couple in there myself. And we pick reading glasses more frequently because we can see at well. So these are more noticeable signs that we have as we age. However, do you know that with age, we can also experience some health concerns or other things that might not be as visible? Well, shingles is one of them, you know. And if you are noticing things in yourself or in a loved one, and that has to do with what we're going to discuss further today, well, that means you need to be well informed and then take that knowledge into action to help yourself or people you care for, people you care about. So let's go to the definition. Shingles. What is it? Simply put, is a disease that affects your nerves. And we know, all of us, we know that when our nerves are affected, it's deep trouble because our nerves go everywhere. I remember at one time in 2010 where I had a condition that had to do with my nerves. It impacted how I walk, the movement I make, everything. So when we know shingles had to do with our nerves being affected, we want to be careful to learn more and take action. Once again, we want to get the tips into dealing with all these more naturally and all that. So shingles then is a disease that affects your nerves. We just said that. And if you may recall, maybe you yourself or someone else, many people I know have had it, have had chicken pox as a child. Shingles, although not being exactly chicken pox, is very remarkably similar to that in how it expressed itself. So how about we talk about the early symptoms of that? We can think about enlarged lymph nodes, fever, chills, headaches, itching. We can also mention raised dots on your skin and redness in that area. No matter the color of your skin, if you have shingles, you notice those things. Okay? You can also notice if this is becoming now something we should worry even more about. Stabbing or shooting pain, tingling or burning feeling in or under your skin, or even upset stomach. Well, we have to say that these are things you may experience maybe sometime apart. But when you have all these together, you want to go check it out what it is. So these are the early signs we can already mention from the start about shingles. We've defined it. We just talk about some early symptoms. So if we want to sum up the symptoms, we can say that this is a very painful, that could last about 2 to 4 weeks situation. And shingles triggers, we just said it, burning, shooting pain, tingling, and or itching. It can also cause a rash and blisters. We talk about raised something on the skin, in or under it. That's what we're talking about now. And this can occur anywhere on your body. Yet, it often appears as a single stripe of sores that wraps around either the left or the right side of your chest. So like here or here more often. Although this can happen anywhere. And more commonly, it happens in older adults. So we've discussed the early symptoms, signs, and we've just expanded even more on those symptoms. And we've mentioned, think about older adults. That doesn't mean it can happen to younger ones. Again, Now, what are the causes? Before we go on with the causes, let's go on to say hello to some friends that are showing up. Awesome, awesome. We have Mauto here with us. Hello, Efa. It's nice to have you always here supporting. So we were talking about shingles today. And this is a serious matter as it can affect, parents, aunts, uncles, or even dear friends. And it can be happening sooner, but all the more so as we aging, meaning when we're becoming more vulnerable. And now we about to discuss the causes. What led to that? Oftentimes, when we know where something's coming from, we can either prevent or know how to work things out when it does happen. So knowing the causes matters a lot in many situations. So let's just put it this way. Shingles is due to a weakened immune system. Okay? What do we mean by that? We've already explained to a point that as we grow up, our immune system becomes weak. It becomes weaker. Excuse me. Someone needs to grab some water. But let's go with this. So simply put, it is due to a weakened immune system. It could be due to stress. We all experience stress, all the more so. Even little kids experience, but it is something that can be significant enough to lead to that. Injury, certain medications, yes, and that's terrible. You're trying to feel better because you have a situation, and that trying to get well, taking on medication can lead you to have this, and that's terrible in itself. But we got to know, yes, it does happen to be the cause of shingles too. And there are other factors like our common topic that we've been discussing, cell degeneration as we age, that can cause shingles. Okay, so even if we're not subject to any medication that might cause it, we're not under stress, we don't have injury, our immune system is like really on top of all that. There is one factor none of us can really avoid right now, at least in this system that we live in. No one can avoid aging. That factor is affecting each and every one of us. So even if we shielded from anything we've already mentioned, aging is on all of us, and so is weakened immune system. So this disease is from the same viruses that causes chickenpox, and we mentioned already that it is very similar to that. It's because both originate from the same parent virus, okay? And one can even, because you've had it, but let's talk more. The varicella zoster virus, okay? That's what chickenpox and shingles have in common. Now, after you've had chickenpox, what happens? The virus lies inactive in your nerve tissues, okay, near your spinal cord or brain. It's there, quiet, not moving, not reacting, not doing anything. That's what happens once you've had chickenpox. So it's there. Now, it wait patiently there, and years later, and when we're talking about you aging, so you understand from, little toddler where you had chickenpox, or baby where you had chickenpox to someone past 40, past 50, in the 70s, many years have passed by. And now what happens? That virus that was lying inactive there may reactivate. Notice we say may here. Why? That means it doesn't happen in everybody that has had chicken pox. But when it does happen, you understand that's zoster virus that is coming back into another form. That is activating something else. That's why we're saying may reactivate as shingles. So now we know where it comes from. How about we talk about the consequences? Because after all, if something happens and there's no consequences, why should you bother about it? Why does it matter? But here, the fact is, the consequences can be really terrible at times. And if you've known anyone that has had shingles, you know that hurts pretty bad. And not only the person having that is hurt, but also the whole family is affected, because you can see someone you care for hurt and not hurt yourself. Okay. So when we're talking about this, our main goal is to inform, because unless someone look into this, there is little we know about shingles other than the hurt part. But when we understand where it all comes from and what we can do about it, it matters a lot and can ease some of the pain that comes with it. So, once again, I really want to thank y'all watching, y'all being with us right now. We appreciate your full support, loving support every Saturday, or rather every other Saturday, because in between we having to just rebroadcast what has happened for those who miss it. As you know, many work on a Saturday, don't they? Or for any other reason might not be there. So why don't we go about more about this? Well, right here, we're going to talk about consequences. And we can recover from shingles even if left untreated. But in the meantime, there is trouble, especially if left untreated. So what will you hurt in the meantime? Okay. So when left untreated, what happens? We're going to first talk about the long-term effect of shingles. Because remember at the beginning, we mentioned 2 to 4 weeks. When you think about high blood pressure or diabetes, that some other things that you drag your whole life, you may think, well, not a big deal. 4 weeks, I can handle that. But the consequences are not going to last 4 weeks. Okay? They can be your whole life. So, number one, if your nerve fibers are damaged during your outbreak of shingles, what happens? Well, something that is damaged can't work anymore. So it is with the nerves. They can send messages. You can feel things. That's one of the things. You can have some senses you have thanks to nerves. Okay? So they can send signals to your skin, from your skin to your brain, as they normally do. And that's pretty bad. Instead, what happens? The messages become confused or exaggerated. Okay, so that's now an accurate message that will go to your brain for it to take action this time. Okay, and that can cause chronic, often excruciating pain. Okay, that lasts months and even years. So, from something that lasts about 4 weeks to give all that, if left untreated, we understand we can't leave it untreated. There are things we need to do and should do about it. And that's why we're having this chat right now. That's one. So depending on which nerves are affected, shingle can cause an inflammation of the brain. That's what is commonly called encephalitis, a facial paralysis, or hearing or balance problems. Now, one other thing is that if shingles, wounds, and swellings are not properly treated, again, bacterial skin infections might develop. And what else can we say? Shingles may raise the risk of heart attack. Now you may think until now I can handle it, but heart attack is no joke. Okay? And stroke by 41%. The risk of stroke by 35 and the risk of heart attack by 59%. So think about these numbers. We should seriously think about this and take action. So those are the long-term consequences we've talked about. And depending on our makeup, on our body, and how we've lived our lives, other things can even jump in to make it even worse. So this again is serious. Now, let's talk solutions. And that's the part we love better. That's where the tips come in. Yeah, it's good to know what's bad in itself, but if we don't have the solution or the approach to solution to deal with it, then what good is it? So again, as usual, talking about manner handy tips, we thinking and we feeling healthy lifestyles or natural products. Okay, so let's reassure you that shingles is not a life-threatening condition, but it can lead to one, and it is very painful. So, what can help? Vaccines. Every and anyone eligible should take the shingles vaccine as soon as possible. We don't want to play with that. Why? Because it can reduce the risk of shingles. Okay? And all the more so should you head to that if you know you've had chicken pox when you were a toddler or a baby years ago. Because that virus is lying inactive and will wake up one day and may wake up in some people. What else? Early treatment can help shorten a shingle infection or rash or outbreak and lessen the chance of complications. See, again, it is the complications that makes it hard. So we want to be aware. We want to be informed. What else? Well, we all know what we're supposed to do. When thinking about natural solutions, we all know that we should do what? Eat well, stay active, maintain a healthy lifestyle in addition to regular checkup. Why? Because it is the doctor that's going to diagnose that shingles. Manner handy tips will not. It will provide you the tips, but it is important to have regular checkup. So when you know you're heading there, you know what to do. Or before you get there, you know what to do. So foods that have been found to increase the shingle virus, to make it more angry, for example, should be avoided where possible. Now, what are those? Food that has the amino acid arginine that stimulate the virus to replicate, such as nuts, seeds, soy products, oats, coconut, flour, white or whole wheat will do, and chocolate. I love dark chocolate because I've heard it's the best. Okay, so these things we need to be cautious about. Even though dark chocolate is helpful for some things, when you're having shingles rashes, you want to stay away from those. Absolutely. And even if you a supplement taker, you help yourself with supplement, and there is a supplement that might have arginine and other things, during your rash, your outbreak, you don't want to be indulging in those things. So we mentioned some. I'm a big nut eater too. Almost every single day, my breakfast, it has to do with cereals and nuts and almond milk. But again, we want to be careful if it is about that time of shingles. We want to avoid these things. But sometimes all this can be easier said than done. For example, I know for me, as I love nuts and this dark chocolate, it will be hard to refrain from it. That's why supplement comes in. Supplement for what? Of course, without the supplement, that will have things that will make your shingles angry. Okay, so this supplement that will really reinforce your immune system. Because remember, a weakened immune system can lead to shingles. Okay, infection. Remember, one of the consequences can be skin infections and other things. So, and you want to get the best. Look behind me. I often mention it, but let's move on. You really want to reinforce your immune health and not be prone to infection. So supplement can help with that, you know. And and this is a fact, okay? There are approximately 1 million cases of shingle in our country, the US, each and every year. 1 million, you agree with me, that is a huge number. And if we can take this information to help someone, isn't that not worth doing? And also, as I always say, you know where to come if you have questions about this that we're discussing today, or you would like more information, or you have just name it. Mana Handy Tips on Facebook will point to the natural resources that can help you, the best supplement in town, I may say. So, the studies also show that not only do we have about 1 million, but that shows that 1 out of every 3 people will, and this time we're not saying may, but we're saying will develop shingles at some point in their lives. And unfortunately, the elderly are particularly vulnerable. And just watch the news or get on Google and tap shingles. You're going to see pictures that will break your heart. And that's one of the reasons why we didn't want to, at Mana Handy Tips, to display pictures of these, because it makes me feel miserable personally. But feel free, go on there, Google, and you'll see. You'll see for yourself multiple pictures, videos, and other things. This is something terrible. Make no mistake about it. I don't, in any word, see my loved ones, my mom, or others around her age, or myself one day going through this. So we'll do well to take action now and do something about it. Okay? So, what are the facts, as we say? Frequent questions that need answered. Shingles itself is not contagious, because some may wonder, if someone have shingles, is the person gonna give it to me? Should I stop taking care of my loved one because they have shingles? No, it is not contagious. However, we need a caution here. The varicella zoster virus is contagious. And if you have shingles, you can spread the virus to another person. We will develop anything else, it will develop. And that could cause them then to have chicken pox. So we want to repeat this. Shingles is not contagious. We've established that. However, the virus that causes shingles, that one can be spread to someone, and that person will then have chicken pox. So we want to take caution still when we're taking care of people that have that. And there are practical things that we do, that we're doing right now because of the pandemic we're living in, washing hands, that we should be doing often while taking care of people with shingles. Okay, that doesn't mean we should stop caring for them, but we need to be careful because they can spread the virus, not the disease, that will make you develop the primary disease that we had when we were little. Okay, what else? Shingles, another fact. Shingles can sometimes be mistaken for another skin conditions. Which ones? Like psoriasis or eczema. Okay, a doctor should always be seen, if shingles is suspected, because psoriasis or eczema, you can deal with it without going through all the trauma. Is really visible on your skin, is unpleasant certainly, but you can't even compare with shingles, with the pain, the shooting, stabbing pain, all the things we've described in today. This doesn't come with psoriasis or eczema. Okay, you can have that and still go on actively with your what you do in life, but with shingles and the pain that comes with it, there's no way things can keep going normal. So if you suspect that, you need to run to the doctor to confirm it and then deal appropriately with it. Avoid all this food that we've talked about. That should become a no-no because you have a shingle, no matter how much you love them before. And because we know these things, we want to do all we can, right? We want to do everything we can. Oh, let's see who is here. Hello, Lydia. It's so nice to have you also watching and taking advantage of this. And I know, particularly Lydia, because of your work, that this information will be really valuable to share with people around you. So please take it in, and I appreciate your time with us today. But remember, this is gonna be out there so you can watch and watch again and get the tips and go use it for people you care for. So thanks for being of support again today. So we were wrapping this up, and we were saying that although shingles can be mistaken for psoriasis or eczema, we want to do well to know if we suspect that it is shingles, run to the doctor, confirm, and then take action. So what is the takeout from all of this? Well, shingles is a disease that affects your nerves, and we know our nerves are precious, okay? And it comes from the same virus that caused chicken pox in our body when we were little. What does that virus do? It just lay inactive for years and then may reactivate as shingles. And if we remember, or we may not remember, but our parents surely remembers how much we hurt when we were little, right? And now as an adult and aging, very vulnerable, having to go through this again and even worse, really, we need to take natural things to really make sure that we don't have that. You're so much welcome, Effa. It's a pleasure to exchange tips, and we welcome your tips as well on this channel. Again, this is Radio TV Aloe Vera, where we see Shirley talk about this wonderful plant, and you can guess it. You come really handy for these shingles we're talking about here. So we again are thankful for Radio Aloe Vera, Radio TV Aloe Vera, and as you know, that's where we're gonna be airing from now, talking about the tips we all share. So yes, it does affect our nerves, the shingles, and also what else? We've talked about the symptoms. We mentioned early symptoms, and we mentioned many things about it. And then we talk about the process of using our natural resources, even if that means saying no to some food we love when we're having outbreak, and how to take care to still be around people that have shingles. So this is the information we had today, and these were the tips for today. Guess what? We're gonna be around together again in 2 weeks. However, next Saturday, this will be aired again from this same channel, Aloe Vera channel, that is called Radio TV Aloe Vera. And I want to thank all of you for your time today. It's much appreciated. But if we have the info and we do nothing about it, nothing will happen. So we want to use it and benefit our loved ones and people, even strangers we meet that we know have these. We can tell them, give them the information and help them to avail themselves of the natural things we know can really strengthen their immune system and help them fight infection and so on. So they don't have to deal with the terrible consequences, long-term conditions that may come out of it. So again, we want to thank you for your time today. And don't forget, we'll be back. Until then, use this info. And if you want more, you know where to go. Mana Handy Tips on Facebook, or you can just email us. Either way will work. We'll be right here, and together we will exchange tips and talk about some more. So today, your presenter was Mana. My name is Mana, as you guessed, and this was Mana Handy Tips. We thank you so much for your time today. So long. Bye now.